In the past few years, intimate partner violence has been on the rise across this country. It is a serious public health crisis that can have long-lasting, devastating effects on families and communities. According to the national statistics, nearly 10 million Americans are victims. That can be men, women, pregnant women, college students. What can we do to prevent such a horrible public health crisis? What can we do as health professionals? Welcome to Nurse Informed. Let's discuss it. Hi, my name is Michelle George. Welcome to another segment of Nurse Informed. We are going to talk about a very serious health topic, intimate partner violence. What is the cost to communities and to families? And later on, in a few moments, I'm going to have a special guest, Larminda A. Davis, a licensed social worker, to talk about such a serious topic. Intimate partner violence, it has negative health outcomes on victims. Whether it's work productivity, whether it's chronic stress, you would not believe the impact that it can have on communities. Although personal consequences of intimate partner violence are devastating, just think about the economic costs when you talk about the criminal justice system with the perpetrator doing the crime going to criminal justice system. When you talk about the victims of intimate partner violence, they have spent over $100,000 in their lifetime in terms of costs with injuries. You're talking about $1 trillion system that can impact communities. When we look at the statistics of intimate partner violence, 1 in 4 women and 1 in 9 men can become a victim. 20% of females and 10% of males in high school have become victims of intimate partner violence. Preventing intimate partner violence is a priority of the Center for Disease Control to make sure that we keep our communities and families safe. Intimate partner violence is a significant public health issue. It has many costs in society. A lot of the victims, unfortunately, it can lead to homicide. And we're going to be talking to Ms. Davis about that and more as we move in a few moments. But in the United States, victims are killed by current and former partners that we see every day. Even pregnant women can be a victim of intimate partner violence. And if the pregnancy is unintended, it increases the risk. We've even seen in the news where law enforcement officers have been a victim of intimate partner violence and nurses as well. So what can we do as a community? So I am going to introduce my guest, Larminda A. Davis. She is a licensed social worker. She is an inaugural director of Wayne State University's Sexual Violence and Prevention Program. She recently served as professor of Wayne State University School of Social Work. She serves as a director of the program at the Sasha Center, which is a local sexual assault agency. She conducts training on a variety of women-focused issues. She is a sought-after speaker. She's an expert in the subject matter in terms of domestic and sexual violence, including human trafficking, goes beyond measure. She earned her Bachelor's of Arts degree and Master's of Social Work at Wayne State University. She's a doctoral candidate at Walden University. She is the past president of the Detroit Alumni chapter of Delta Sigma Theta Sorority Incorporated. She's married and has 1 daughter. She attends Triumph Church, where she serves in the music ministry. Let's welcome our guest, Larminda A. Davis. I want to welcome my guest, Larminda Davis, to Nurse Informed. Larminda, welcome.
Thank you so much for having me, Michelle.
Let's get started. Larminda, what is intimate partner violence and what's the difference between domestic violence and intimate partner violence?
Well, they're very similar, and sometimes you hear them used interchangeably.
Okay.
But intimate partner violence is violence between people that's involved in a romantic relationship.
Okay.
Or have been involved in a romantic relationship, where domestic violence can also be besides partners. It could be siblings, it could be mother, father, children, and things like that. So domestic violence involves more people. Intimate partner violence involves just the 2 people that's involved in a romantic relationship.
Okay, thank you for explaining that, Larminda. Why do a person abuse, Larminda?
Intimate partner violence is about power and control.
Okay.
There's a lot of things that you will hear. There's a lot of excuses that perpetrators use.
Wow. Okay.
But ultimately, the root of it is it's one person trying to obtain power and control over someone else.
Wow. Okay. Thank you for that. How does the intimate partner violence, how does it affect families and children?
Well, the effects of intimate partner violence, they're very far-reaching and they're long-lasting.
Okay.
So it impacts us, as you mentioned earlier, as
Mm-hmm.
communities, the
Yes.
costs involved, and we don't think about it
Yes.
in that realm. We only think about the impact immediately, which it does impact families. It leads to broken homes.
Yes.
It leads to broken relationships, and we know all of the things that come along with that, right?
Right.
Then it also impacts the children
Yes.
who have witnessed intimate partner violence. And there is a correlation with intimate partner violence that children are sometimes more likely to be in an abused household also. So child abuse
Okay.
often go hand in hand with intimate partner violence. And so it impacts every fabric of our community.
Okay. If a child is exposed to violence,
in the future.
In the future, could that lead the child a possibility?
It could, because when a child witnesses that in their home, it becomes normalized, right?
Okay.
So you think that's the way relationships are supposed to be.
Okay.
So they could either become perpetrators,
okay,
or they can be extra sensitive and not abuse. They could say, I watched my mother go through that and I'm not going to do that.
Okay.
Or they can say, that's what love is, right? And so they can become perpetrators. But as we talk about children, exposure to violence also comes with emotional damage, mental damage, depression.
Yes.
Right? And also we see higher anxiety in children who were raised in homes where they witnessed intimate partner violence. And poor performance in school. So, and as you mentioned, the spillover into their adulthood and into how they then have relationships with others.
All right. Thank you for that, Lorinda. Why has it increased over the years? Did it increase during the pandemic? Was it as high before the pandemic?
It is on the rise, period. And I really, when we talk about this, I don't want to let perpetrators off the hook.
Yes.
Because ultimately it's about power and control. Right?
Yes.
So to bring it back to that.
Yes.
But there are things that's correlated
Wow.
with the rise of domestic violence or intimate partner violence. Stress. We live in a stressful society.
Yes, we do.
There's a lot of things that lead to stressors. Financial burdens, unemployment. All of these things lead to stress, and that makes the perpetrator more likely to abuse.
Oh, wow.
Substance abuse, alcohol abuse. Again, not to excuse the perpetrator, right?
Yes.
But these things do increase the rates of domestic violence.
Okay.
Lack of resources that's available to survivors or victims of domestic violence. And just this community that we live in is still very patriarchal.
Yeah.
Women are still seen a lot of times as property. And that's perpetrated in our media more and more, I think. And violence is so normalized, right? We're desensitized to it. And it makes it easier for perpetrators to commit violence against their loved ones.
Okay. Can perpetrators be females?
Yes. Domestic violence, intimate partner violence, you mentioned it earlier. It goes across all lines, racial, socioeconomic, cultural, religious, age, same sex, same gender loving.
Yes.
It hits everybody.
Okay.
Nobody is exempt. It does not discriminate.
Wow. I know a lot of times, what if victims come to you and say, Larminda, they were told that the most dangerous time is when they leave and they could be killed. What would be your advice to the victim?
I would tell them they're absolutely correct.
Okay.
That is the most dangerous time often in a relationship because, again, intimate partner violence is about power and control. So if that perpetrator discovers that their person, their partner or spouse is leaving, they will do whatever they need to do to get that power and control, even if it is murdering that person.
Okay.
And sometimes murdering themselves, but ultimately who had the power and the control in that situation.
Okay.
So it is a very dangerous time. It's not unlikely for victims to leave and come back and leave and come back. Mm-hmm. And people don't understand that sometimes staying is the safest option, especially if children are involved.
Wow. Okay.
So we're so quick to say, why don't she leave or why don't he leave?
Absolutely, you hear that a lot. Mm-hmm.
But they may have assessed the situation and at this point in life or time think that that's the safest option for them.
Okay.
And so if someone is thinking about leaving, they need to do so safely. They need to develop a safety plan. They need to involve people, others that can help them. And if they so choose, seek out a personal protection order. Mm-hmm. But like what I tell survivors that I work with, that's a piece of paper, right?
Right.
So you have to take steps to protect yourself if you think there's some propensity for violence or harm, ultimate harm of, shooting or stabbing or stuff like that.
Okay, but the key thing is have that plan.
Have that plan.
And reach out for resources and family.
Yes.
Okay. If a person who abuses, Larminda, if they're watching this video, what would be your advice to the abuser?
That there's no excuse for abuse of someone that you say that you love. I would say that your abusive tendencies are your choice, and the only person that can stop you from abusing is you. I would say to seek out help to help you understand why this is something that you do, be it counseling, be it a trusted friend, be it a clergy person, but ultimately only you can stop the behavior that you're doing. So work on yourself. It's not cool and it should stop.
Okay. And another question I want to ask you, Larminda, why is verbal abuse, why could it be just as worse than physical?
There are several forms of abuse: physical, emotional, mental, verbal, and they all play together. Okay. And oftentimes you see several at the same time.
Okay.
So this is how it plays together. If you verbally abuse me and mentally abuse me, you tell me I'm ugly.
Okay.
I don't nobody else want me. You've isolated me from my family. That's another form. Like you don't talk to your mother. They don't understand. Don't talk to your girlfriend. Your girlfriend likes me, right? Your friends like me. You let's keep you away from them, right? And you using threats.
Yes.
If you leave me, I'm going to call Child Protective Services, or I'm going to hurt your family.
Okay.
So you put all these things together. It doesn't matter how much self-esteem I had. If you're telling me every day that I'm ugly, I'm stupid, don't nobody want me, I can't pick up the phone because you've isolated me, right? I might not have financial resources because you've also been abusing me financially, where you give me an allowance, or you take my check, or you've made it so I can't work. So all of these things work together. And verbal abuse is, they say sticks and stones may break my bones, but words do hurt. They do hurt. So if you're telling me I'm ugly, I'm stupid, nobody's going to want me, I then have to repair that. It takes me telling myself that I'm not ugly. I am smart. 100 times to your 4 times. If you telling me that every day.
Wow.
So the physical abuse is the most extreme of it, but all of these things work in concert together. It's not usually one.
Okay, so basically you just broke their spirit.
Yes,
Wow.
Exactly. Exactly.
Wow. What would be your advice to victims?
Well, if a victim is watching this, I want you to know that I believe you. I support you. I want you to know that there are resources, both locally and nationally, to help you if you decide to choose. And I say if you decide to choose, because ultimately the choice is yours. And just to you, like people say, why don't they leave, right? A lot of times the victim wants the relationship to work.
Wow.
They just want the abuse to stop.
Okay.
And sometimes it's just not going to stop. So I want you to know, if this is something that you're going through, that you are worthy of a relationship free from violence. And there's help if you so choose to seek it.
Thank you, Larminda, for that. And the last question I'm going to ask Larminda, how can intimate partner violence be prevented?
It takes a multi-layered approach, right? We need work on all levels. We need work on individual level, community level, societal level, global level, right? We have to deal with some of these things that's still very patriarchal in our community.
Okay.
We have to work on strengthening women's civil rights, related to divorce, related to poverty, related to what they do with their own bodies, because that trickles down. Like the government can tell me what to do with the body, so you are property. You're not valued, right?
Yes.
We need to reform our civil and legal frameworks and laws. There's more laws for somebody to abuse an animal versus somebody that abuses another person.
Okay.
So we need to look at that and strengthen those things. We need to continue to do social media and awareness campaigns, because people think that this stuff has gone away.
Yes.
And it hasn't. We already talked about it increasing, right? We need to work with the babies in school. We need to start early, talking about what healthy relationships look like, and how do you have healthy communication with those of the opposite sex or those that you say that you love. We need to strengthen economic support for families. So to deal with some of these things that's causing stress, which we say leads to domestic violence. And it takes individuals, it takes nonprofits, and it takes the government all working together.
Okay. Wow, Larminda gave us a wealth of information. And when you look at the screen, as Larminda stated, that there are resources that are there, the 1-800-799-SAFE or 1-800-799-7233, and also the Michigan Coalition to End Domestic and Sexual Violence. There is a number that's on the screen, 866-864-2338. And we just want to remember what Larminda has said. If you are experiencing domestic violence, seek out those resources. If you're experiencing intimate partner violence, seek out those resources. Thank you, Larminda, for being my guest and sharing that wealth of information and your expertise on this topic.
Thank you for having me. And together we can end domestic violence.
Yes, thank you. So as we end this segment of Nurse Inform, as Larminda stated, and we've seen so many people being victims of intimate partner violence, domestic violence, that have impacted our communities, our churches, children. I want to thank for you for listening in. And we want to remember those families who have lost daughters and children and aunts and uncles of domestic violence. So at the end, as you know, I always have music at the end of my video. So I want to thank Bishop J.D. Means Sr. He has a CD. If he bring you to it, he'll bring you through it off of his CD. Near the Cross, a instrumental version. He is the pastor, the senior pastor of Hills Avenue Baptist Church in Atlanta, Georgia. He is also the senior pastor of Praise and Worship Celebration Center out of Atlanta, Georgia. So Bishop Means, I want to thank you, and we will continue to keep you and First Lady Means in our prayers. Thank you for tuning in to Nurse Informed.